Today, we embark on an exploration of a topic that touches the very fabric of our emotional well-being. We will delve into the subtle signs that indicate toxicity and unveil strategies for finding clarity, setting boundaries, and fostering healing. Relationships, whether family, romantic, or friendships, are meant to be sources of support, joy, and growth. However, sometimes we find ourselves entangled in webs of toxicity that can erode our mental and emotional health. Identifying these toxic dynamics is the crucial first step toward reclaiming our agency and steering our lives toward healthier shores. Signs of toxic relationships: constant criticism. In healthy relationships, constructive feedback fosters growth. However, in toxic relationships, criticism becomes a pervasive and destructive force, undermining your self-esteem and leaving you feeling perpetually inadequate. Lack of respect for boundaries. Healthy relationships thrive on mutual respect for individual boundaries. Toxic relationships, on the other hand, involve a consistent disregard for personal space and emotional limits. Manipulation and control. Manipulative behavior is a hallmark of toxicity. This can manifest as emotional manipulation, guilt-tripping, or attempts to control your decisions and actions. Excessive negativity. Toxic relationships often revolve around a consistently negative atmosphere where optimism and positivity are stifled. Constant pessimism and cynicism can create a draining emotional environment. Isolation from support networks. Toxic individuals may attempt to isolate you from friends and family, diminishing your support system and making you more reliant on them for validation. Gaslighting. Gaslighting is a form of psychological manipulation that seeks to make the victim doubt their own perception, memory, or reality. It's a particularly insidious tactic used by toxic individuals to maintain control. Emotional or physical abuse. Perhaps the most blatant sign of toxicity is any form of abuse, whether emotional or physical. This includes verbal abuse, threats, or any behavior that causes harm to your well-being. Strategies for navigating toxic relationships. Self-reflection. The first and most crucial step is self-reflection. Acknowledge and understand your feelings. Are you consistently anxious, drained, or unhappy in the relationship? Recognizing your emotions is the foundation for change. Establish boundaries. Clearly define and communicate your boundaries. Toxic individuals often push limits, so it's essential to be firm about what is and isn't acceptable behavior. Setting boundaries is an act of self-care. Seek support. Reach out to friends, family, or a therapist. Share your experiences and feelings with trusted individuals who can provide valuable perspectives and emotional support. Educate yourself. Understanding the dynamics of toxic relationships is empowering. Read books, articles, or attend workshops on the subject to gain insights into recognizing and navigating toxic behavior. Communication. If you feel safe doing so, communicate openly with the person about your concerns. Express how their behavior impacts you and be specific about what needs to change. However, be prepared for the possibility that the toxic individual may not be receptive to your concerns. Build a support system. Cultivate connections with positive and supportive individuals. Having a robust support system outside the toxic relationship can provide the strength needed to make difficult decisions. Consider professional help. In some cases, toxic relationships may require professional intervention. Therapists or counselors can offer guidance, support, and tools to navigate complex emotional landscapes. Plan for change. If the toxic relationship is one you cannot fully extricate yourself from immediately, create a plan for change. This might involve gradually distancing yourself, seeking legal advice if necessary, or developing an exit strategy. The journey to healing. Healing from a toxic relationship is a multifaceted journey that demands patience, self-compassion, and time. It involves reclaiming your identity, rebuilding self-esteem, and fostering a renewed sense of self-worth. Self-care practices. Prioritize self-care activities that nurture your physical, mental, and emotional well-being. This might include exercise, mindfulness, and activities that bring you joy. Therapeutic support. Seeking therapy or counseling can be instrumental in the healing process. Professionals can guide you through the emotional aftermath, helping you process and make sense of the experience. Rebuild relationships. Invest time in rebuilding relationships with those who support and care for you. Healthy connections can reinforce your sense of belonging and contribute to the healing process. Learn and grow. Transform the pain and lessons from the toxic relationship into opportunities for personal growth. Use the experience as a catalyst for self-discovery and positive change. Set future boundaries. Reflect on the patterns that led to the toxic relationship and establish guidelines for healthier connections in the future. Identify red flags and trust your instincts in new relationships. In conclusion, navigating toxic relationships requires courage, self-awareness, and a commitment to one's well-being. Recognizing the signs, implementing strategies to protect yourself, and embarking on a journey of healing are pivotal steps toward reclaiming your agency and fostering a life filled with positive, fulfilling relationships. Remember, you deserve to be surrounded by individuals who uplift and nurture your growth, and the journey to healthier relationships begins with prioritizing your own well-being.